and you heard us report this yesterday, or maybe it was Tuesday, about how the clinical tests have been done, and now ages 12 to 15 can receive a version of the vaccine. So kind enough to join us this morning is Dr. Michael Bigham from Akron Children's Hospital. He is Akron Children's Chief Quality Officer. And Michael, thanks for being part of the show this morning. Talk about as you saw the clinical tests come through for these teenagers in regards to the vaccine.
Sure, great. Thanks for the chance to have a conversation this morning. So what we know is that Pfizer's been evaluating the vaccine in kids 12 to 15 years of age. That study's closed. They enrolled just over 1,000 children in a treatment arm, so they got the vaccine, and then they enrolled another 1,000 kids in a placebo arm, which means essentially they got the fake vaccine or just saline, and then they compared the outcomes of those two kids, and they certainly saw a robust response to the vaccine in the kids who got the actual vaccine, meaning that they got a nice response in antibodies. And what we know in the group that got the vaccine, there were no cases of symptomatic COVID. In those kids who got the fake vaccine, there were 18 cases of symptomatic COVID in those children. And so that led them to make a proper conclusion that the vaccine seems effective in those kids 12 to 15 years of age, and the antibody response, which is one of the measures aside from clinical disease, was quite robust in the kids 12 to 15. And so that certainly affirms that the vaccine works in that age group, and it's now under review by the FDA. It's not quite approved yet in kids 12 to 15. I think we expect that either over the weekend or early next week, but it should come then.
With us is Dr. Michael Bigham from Akron Children's Hospital. And Michael, I'm a parent of four, and many people listening to us this morning, parents as well. And you know what the question is? The obvious one is, do my children need the vaccine?
Yeah, so it's a great question. I'm also a parent. My 16-year-old, who's been eligible now for a couple weeks to get the vaccine, has gotten both his first and second dose of vaccines, and that sort of maybe tips my hand as to my confidence in the vaccine and my confidence in the fact that there are a couple ways to for our society to get out of this pandemic, and one of these is to prevent transmission of illness. And we've got many years of experience around other vaccines and the benefit of vaccines in preventing disease transmission. And this, for me, fits that same category. There's a reason we get measles vaccines. There's a reason we get vaccines for other serious infectious illnesses, and the same is true for the COVID vaccine. And I think one of the misnomers maybe or misconceptions about COVID infection in children is that it's not a problem, and I think that's inaccurate. We know kids can get symptomatic with COVID. We know they can get ill with fevers, aches, pains. We know there are some post-COVID complications that can be rather significant in children. The rates of those are low, but they're not zero. What's been portrayed accurately in the media is that the hospitalization rate and the death rate from COVID illness in children is certainly lower, and we as pediatricians are grateful for that, but that doesn't mean they can't get symptomatic COVID. That doesn't mean they can't transmit the disease, and so we are encouraging the children to get the vaccine because it's certainly important to help our society emerge from this pandemic.
With us is Dr. Michael Bigham, Akron Children's Hospital. He is Children's Chief Quality Officer. Michael, you mentioned symptomatic as regards to the vaccine with these teens 12 to 15. What about the vaccine in fighting asymptomatic development of COVID-19 in teens?
Yeah, so again, the study is small, but we think it should work in children 12 to 15, similar to the way it works in adults, or even at least kids and young adults 16 to 25 or 30. And we know that it reduces COVID infection. I think the evidence continues to emerge and will probably emerge with more confidence that it's reducing transmission as well, including of asymptomatic cases. And so for those reasons, I think both symptomatic and asymptomatic transmission it would be, though it's not yet clear in the 12 to 15-year-old age group, we think it should play out similar to the adult studies that would reduce transmission as well.
Michael, my other question is, and certainly you with a doctor at Akron Children's, what has been the teens' role, whether it be across the country or globally? What has been the teens' role in the COVID-19 spread? Is it large? Is it smaller? What have you seen from your perspective in the medical profession?
Well, I think we've seen a couple things. First of all, if we look at the percentage of all cases of COVID that are happening right now, there's a growing, so whether it be nationally or whether it be even in the state or even at Akron Children's, the younger age group has a growing percentage of overall cases. And so maybe said differently, whereas earlier in the pandemic, a larger percentage of symptomatic COVID patients were adults. Currently in the pandemic, a larger percentage of COVID cases are testing positive in children. And so just to give you a perspective, I think in the state of Ohio, just under 20% of the total COVID cases are happening in kids under the age of 18, and that number has gone up month over month. Even back in December, it was under 10%, and so there's a higher percentage of the total number of cases that are happening in teenagers. And I think that might be because more and more of the adults have either acquired disease or been vaccinated because they were earlier in their eligibility for vaccines.
Michael, I have one more question for you, but if you don't mind holding on, I need to get traffic and weather first. I'll get right back to you with an update on traffic. Here's Stephanie.
Highways look good, but you still have some light congestion in the construction zones on 77 northbound at 30 and on Route 8 southbound from 303 to Graham. Route 3 is closed at Baghdad due to downed power lines, and that'll be closed most of the day. And the ramp from 77 northbound to Cleveland-Maslin Road is closed through August. Follow us on Twitter at AkronTXWX. From the Legacy Motors of Akron Traffic Center, Summit County's largest indoor showroom, I'm Stephanie Nicole.
Thanks, Stephanie. 12 minutes in front of 9 o'clock. The forecast says plenty of sunshine this morning, maybe some showers tonight and storms tomorrow. Currently, we are 41 degrees at WAKR. And then, Michael, as we wrap up our conversation this morning, and we've talked about kids and teens and maybe the need to get the vaccine and the role in the spreading, we have a lot of adults, and I was reading some statistics that up around 70% of folks 65 and plus have had at least one shot in the United States of those 65 and over. That's terrific. So my question is, what if we have teens, 12 to 18 years of old that do not get the vaccine? What are the chances of them spreading this COVID-19 to a grandma, to a father, to a mother that even is vaccinated fully?
So if those children are not vaccinated fully, those 12 to 18-year-olds, their risk of spreading disease is very real. We know that. We know we're learning more and more about how the disease and the virus is transmitted. If those kids are vaccinated, fully vaccinated, their risk of transmitting that disease, as I mentioned earlier, that the evidence isn't perfectly clear yet in these younger ages, but we think it'll follow that of the adults, and we think that should drastically reduce the transmission of illness as well.
That's terrific. Okay, so there you go, folks. Get the vaccine, and Dr. Michael Bingham has been with us from Akron Children's Hospital with some good education and intel into the world now with the 12 to 15-year-olds being eligible to get the vaccine. Michael, thank you for the time. I know mornings are busy for you. We appreciate it here on WAKR. Thank you.
Thank you, Ray.